students, welcome to my channel. Uh, Here we are already completed the first part of this public health care. So today we will be talking about the second part of this chapters, especially chapter 4. Here we will be talking about the private health care. So before that we will be talking about how this public health care in fact had some sort of like inconveniences. So those things we can go through first. So here, let us see that public healthcare what exactly creating some sort of like facilities for the people who are in the rural and also in the urban. So let's see. So public healthcare actually consists of like a vast network of the like government health centers, and here the constructions of these centers along with the medicines and equipments are actually provided with the money paid by the citizens as a tax. So it means whatever the tax we are actually paying through our different like jobs, then these are the all actually collected, and then it is in the form of like a construction of the medical or hospitals. These are the things are actually made. But today, for example, the present world is different. The present world we have not seen that there are something is happening. So, however, the structure of public health care actually varies in rural and urban areas. So, in the village setup, what you can see in the village setups, the centers are actually run with the help of like nurses and village health workers under the supervision of the primary health centers. So, you can see in the different villages whenever you will be traveling, you will be able to see that there are the nurses, then a village health workers are there who is a trained in fact, simply they can't go and then inject someone, so they are trained, and then these people are actually trained sufficiently, and they are actually dealing with a common illness. So in the rural setup, you can see that the people who are working in the primary healthcare, in fact, they are trained, and they are actually, especially the very common one, and a very normal one, and an easy one, perhaps we can say. So this type of like a illness are actually treated. So that is we can find. So after the primary health centers come the district hospitals. So district hospitals, of course, you have seen. We are in a district, so we know in every district at least some good hospitals are there. But that depends upon the equipments, availability of the experts and nurses and doctors. So, however, let's see here. Here, what is spoken? So they supervise the functioning of the rural health centers. Now you have to understand that the district hospitals, whatever the people working, doctors working, they are also actually part of the primary health centers of the rural areas. So they are also responsible for that. Now, large government hospitals are actually found in the urban areas. So certainly you have seen in a like a Guwahati, Tezpur, we have seen, or Dibrugarh, where there is a large city, urban areas. Those are actually considered the urban areas. So you will find that big hospitals are actually constructed, and then you can see that these hospitals are actually equipped with advanced diagnostic facilities and a large number of trained staff of doctors, nurses. So in the urban setup, you can see every facility they make available, and then whatever the sickness and infect is taking place, perhaps it is possible there to operate and to cure and to recover. Okay, so here we can see there. So that is about the public healthcare centers, how it is functioning and how the step by step it is actually working. Next we have the private healthcare system. Now, what about the private healthcare system? How this private healthcare systems in fact works, and then what are the outcomes, and how this private healthcare systems actually working? So let's see. So the private healthcare systems, it is a consist of like a health centers established by individuals or maybe the companies. Okay, so with the motive of gaining profit. So here the main profit, or the main their like a purpose is to earn the a huge profit. Now, in order to earn the profit, what they are actually making for. So here see, The organizational structure and facilities available in the private health centers are often considered to be the better than public health centers. So this is one of the uniqueness we can see that there are the equipments and the other facilities which is made available there, which is not found in the public health centers. So in public health centers, suppose due to some problem we may die or we may not be cured. But in the private, they are making available those facilities, and then you can see that those things are actually utilized very systematic way. So therefore, you can see that in the private things are actually better. Uh, Even the schools also we can consider. Okay, in a Delhi city and all is a different case. Delhi city is the state government is working very hard to better to make the education system better. But apart from that, other part of this education systems are very worse in the government level. So how we can check all these areas? That is the weakness we can find in the government sectors. It may say government is paying the huge amount of money to the workers, to the people who are working in the government setup, and yet you can see that the work is a very poor way they are performing. It shows that the government is actually just making the people to survive only. They are not bringing any efficiency in the government sector. Even the schools which is functioning under the government is a poor condition. Buildings, constructions, benches, students are not there. Even teaching also, even the reaching to the schools also very much late. And then you can see that the number of the students are very little. And why it is happening? It is actually government has to examine and analyze. Actually, government knows why it is happening, but everyone has to go hand in hand. So that is the thing they are actually keep on going. Otherwise, today the students who are coming to the like a big private schools and all, they could have been in the government schools if it could have been better. And in the private schools, whatever the money they are spending, they should have not spent the money. Now, one thing I have to say that I am just a neutral. I'm not talking about the bad thing and good thing about, but what is the better the government can do is that in the government sectors, if the teachers are appointed, if the students are given the importance, if they can take care of every bit of things, if they make available, then in the government schools they will they will get the more students coming to the schools. But here we can see that in the government schools, the students, whether coming not coming, the teacher has got no care about that. So they just come and spend the time and then they go away. So that is very often we see in different parts of these states. So that's why the very poor performance in the government part, and then it is a shame. We can say that a shame on the governments this kind of like a policy that they are playing. It may say you can see that the government's teachers or the government employees are very cozy and a very easygoing life, but activities are not performed efficiently, and no efficiency is seen. So I don't know. The teachers also sometimes are appointed for the schools, but I don't know. Perhaps they are also lacking a lot of knowledge with regard to the subject matters. So that is also we have seen in a different places when the this like a investigation has taken place. So all these areas are their weaknesses. So however, the private is making the better, but private is making better. It is not, since it is not the government's like a assistance or a support that equipments are given by the governments, but it is the private companies or the individuals who are investing money to bring such kind of equipments and keeping the making it available for the people. So that's why people rush for that in everywhere. So efficiency we can see, and then also we can see the availability of the equipments through which the people can be cured. So therefore, these centers include big hospitals like laboratories, diagnostic centers, clinics of private practitioners, And the treatment provided by private healthcare providers tend to be unaffordable by large sections of the society. So today, for example, any one of us, uh, suppose any serious ill if we are suffering from, then it's rather difficult for us to spend money and to cure, because it will take a lot of money for the this operation and all. So therefore, most of the sections of the people, in fact, they are unable to do their treatment in the private hospitals. Okay, so okay, next we have got another topic that is called healthcare and equality. Now, why do this particular subheading is given in this part? Especially, see, today the private healthcare is more common than public healthcare. So today more common. It means a private is going ahead of the government. Government is not focusing. Today, for example, most of the private sectors are actually uh, earning a huge amount of money rather than the government's this treatment. Now, why it is happening? While many government hospitals and centers are actually overcrowded and under equipped, most private centers are actually continuously advancing their services and medical facilities. So you can remember that private hospitals are actually updating themselves, because according to the demand of the people, they are actually making the things available. Whereas in the government sectors, we don't see the what called the update of the new machinery coming to the hospitals. And if it is coming also, you won't find the people who are able to operate that machine. Recently, you have heard there were many of the ventilators were brought in the hospitals, but then people doesn't know how to operate these ventilators, and doctors, nurses are unavailable for that. And also, the machine which was brought in the hospitals are actually damaged, means like a poor quality, and within no time it got spoiled, and people, of course, couldn't get the service from this machine. So such incidents happened recently in this pandemic time. So so therefore, we have to think of how the government, in fact, actually taking the initiative in making the things like that available. So therefore, you can see that as a result, despite being a costly, private healthcare services are being preferred over public health services. So, however, it is very costly. The common people, in fact, not able to afford, and in spite of that, you can see that many of the people, in fact, flocking in the private hospitals, and then trying to cure themselves uh, by by hook and crook. They are arranging the money for their sicknesses. So therefore, the growing dominance of private healthcare has been making a situation worse for the poor. So here, the poor sections of the people who are very very little earning is done, then how they can get the this facility. So here they are depending on the governments, they are not depending on the private sectors. So therefore, it is a kind of like a challenge for the poor people who are unable to pay and cure themselves. So it is because of the lack of nutrition, food, then cleanliness, housing, clothes, etc. You can see increase the chances of the poor falling sick frequently, and then frequent illness bring about more anxiety in the family. And family is always in a trauma, and a family is always unable to take care on that. So here, as a result, what happens? The family faces a dual distress of having a member ill at home and the lack of money for treatment. So these are the challenge that is actually we can see. It may say here is the inequality we can see in this case. So, however, it is not always the always that the lack of money stops people from getting adequate treatment. In most families in India, the health of women is ignored. Not only are they denied a nutritious diet, but also their illnesses are not treated as promptly as that of the male members of the family. So this is another issue that we can see some in some families or in some societies, that women when they get sick, they were not taken care properly, and as a result of that women get fall sick, and then they are actually sometimes it becomes very critical condition, and not able to really give the proper care on them. And most of the people in fact some way or the other a kind of like a hatred feeling towards the women when they get sick at home. So this is very like a corrupted minded people are also find in the society. So you can see that in remote areas, the non-availability of proper treatment makes the healthcare inaccessible to the people, while the public health services are not adequate, and the private health services are not even available in such areas. So as a result, the cost of expensive treatment clubbed with the high cost of traveling to a faraway health centers, making treatment out of reach for these people. So you can understand that it's a big challenge for the poor people, big challenge. So you can understand that suppose the good treatment you want to give, then you need to go to the urban areas, and in the rural this facility is not created by the government. That's why in my previous video I have talked about that a healthcare system should be made available in the rural areas with adequate this equipments and medicines and people available, in spite of instead of going to the district level, then city. These are actually funny time. Actually, these are actually the old sort of like things the government actually taking. It may say step by step. People are going step by step, but in the medication it is not step by step. It's all of a sudden people can die. Today the health is not that much having resistance, where you can resist yourself and then you can survive. Today, for example, within a few minutes, people are getting died because of the lack of medicine or the care or the like equipments. So therefore, we have to be very careful. So in every rural setup, even the thing has to be made available so that people can survive, and especially the poor sections. So government, what is doing? God knows. Government is not given the importance on these areas, and I think they are very smoothly going on. And whatever the tax money they are getting, these tax monies they are spending for their campaign, election campaign, rather than to spend for the poor people and to make something very better. So that is why we need to really know to whom to vote, and carefully you must think of to whom you are voting. So therefore, don't simply give the vote unnecessarily by mere like a provocation of what they are creating for the people. So therefore, be careful in this area. So anyway, the last point, we have got another very important point, that what should be done actually. Now see, the health of the citizens of a country is directly associated with the development of the country. So hence, the proper arrangement should be made to care of the health of the citizens. So very important. If the citizens of the country is healthy, means the workforce will be more, and then you can more go ahead and you can develop. If the people of this country is sick and poor, then you can't expect that the country will develop. Therefore, in this area we need to give the focus very importantly. Then this can only be achieved with the collaboration of the government, private companies, and the people of our country. Good quality healthcare should be provided in the entire country, and the government should also make proper arrangements to provide basic amenities to the poor, to decrease the chances of them to falling ill frequently. And then also the private companies should lend a helping hand to the government authorities in providing free or affordable treatment to the poor of the society. So the government should really take initiative to do this kind of welfare job. So health is an amalgamation of physical, mental, and social well-being of a person. So thus, unless we ensure the facilities to achieve these poor people, for the poor people especially, the overall health of the country will be difficult to improve. Okay, so therefore we need to know. So I just would like to suggest you to read through about the Kerala, the case study, page number 238 and page number 239, Costa Rica. how this Kerala and Costa Rica actually um, taking the big initiative to make people understand, to make people to give a better like a treatment with a different equipments available, and also with so much of like a people made available for that. So that is a very important part. You read. I would like to suggest you to read through this one. Okay. So thank you.